Substantial advances have been made in antiretroviral therapy since the introduction of the first agent, zidovudine, in 1987. 6 classes of antiretrovirals are currently available for use, and these classes we'll cover over the next few sketches. In order to reach adequate reduction of viral load and reduce the risk of resistance, antiretrovirals are chosen in combination, tailored to the patient. And as you'll see soon, these drugs each inhibit HIV replication at a different part of the cycle. For our first antiretroviral drug though, let's enter the Arthurian cycle. This sketch is going to cover nucleoside and nucleotide reverse transcriptase inhibitors, or NRTIs. And in this scene, NRTI stands for none other than the legendary Knights of the Round Table. Get ready for tales of chivalry, magic, adultery, lactic acidosis. NRTIs are the backbone of antiretroviral therapy. Treatment regimens usually consist of a pair of NRTIs along with a third agent from another drug class. Here's how NRTIs work. They act by competitive inhibition of HIV reverse transcriptase. If you recall our evil HIV human immunodeficiency wizard from Sketchy Micro, he had a spellbook to magically convert RNA back to DNA called reversotranscriptome. And as you can see, our brave knights have gotten a hold of one of the wizard's books, which now lies open on the table in front of them. Because NRTIs are nucleotides and nucleosides, they incorporate into growing viral DNA strands. However, they lack a hydroxyl group important for phosphodiester bond formation, so this causes premature chain termination. To show this, enter King Arthur at the center of the round table. He's rallying his men, slamming his mace on the table. Notice, his mace looks like a nucleoside, a sugar bound to a nitrogenous base, and one of the spikes is missing. Yep, it's the hydroxyl at the 3' end, which is why DNA elongation is terminated. Let's add in the page numbers 3' and 5' to emphasize that it is 3 to 5' phosphodiester bond formation that's inhibited, and a bookmark that looks like a halted DNA strand. As King Arthur rallies his men, readying his attack on the evil retroviral wizard, notice that he presents a scroll sealed with a P. This is because his NRTI knights, except for one who you'll meet later, are not nucleotides but nucleosides and need phosphorylation by cellular enzymes in order to be activated. Well, this scroll cell signal is officially activating his men, calling them to action. Take a close look at the round table. Looks kinda cistern-y, eh? Yep, it's designed to evoke the image of a mitochondrion. This is because all NRTIs are associated with mitochondrial toxicity. Oh, you're thirsty. How about a nice, curdling bottle of sour milk? The perfect beverage before any crusade, and our recurring sketchy symbol for lactic acidosis, an adverse effect associated with all NRTIs. Oh, no. You first, I insist. And you know what? We all know that the Knights of the Round Table eat ham and jam and spam a lot, so they've prepared a hearty feast. The suffix dine is attached to a few of the NRTIs, a useful tip for recognizing them on the exam. So in this scene, they will be dining at the Round Table. Meet lamivudine, represented by a dining Lancelot. Lamivudine is associated with peripheral neuropathy, and that's why he's wearing our recurring symbol, the old stockings and gloves, like the stocking and glove pattern of peripheral sensory loss. If you ask me, it looks like he's a little bored of this whole affair. Wait, did somebody say affair? Lancelot? No. Wait, really? You can tell me. He has another secret though. He's part of a medieval secret society whose crest is a hippo, the noblest creature of the animal kingdom. This is to remind you that lamivudine specifically is used to treat Hep B, because the hippo is our sketchy symbol for hepatitis treatment. As a little extra reminder, we've included our recurring peace sign theme to remind you of our Sketchy Micro Hep B's Hippies sketch. Because lamivudine inhibits DNA replication, if patients are co-infected with HIV and HBV, discontinuing this agent can result in a flare of hepatitis. Also part of the secret Hep B Society is Sir Tristan, who will represent tenofovir. Tenofovir starts with a T, so remember that this is a nucleotide, not a nucleoside. Therefore, it does not need to be phosphorylated to become active. Think of tenofovir, as in phosphorylation needed to become active. And as you can see, Sir Tristan is not waiting for that phosphorylation scroll. He's already active. And sailing off because the tide is right. That's nucleotide. While the others must wait inside. Think nucleoside, because they need phosphorylation signal. Remember that he also has activity against hepatitis B, just like lamivudine, so he's adjacent to the sigil of the Hippos Templar. But Tristan shares another quality with Lancelot. He also has a secret lover, of course, Isolde. And if I remember the story correctly, the king finds out. Which is probably why Tristan is sneaking out early. Isolde is dining at the table, and she'll represent zidovudine. Remember that "dine" suffix often associated with these nucleoside analogs. Isolde's crest also incorporates a dove for zidovudine. Anyway, as Isolde awaits for her lover's return, notice that she's looking a little pregnant. Yep, she's carrying Tristan's child. A little surprise for him when he returns home. Zidovudine is one of the first-line agents for use in pregnant women. It's used during pregnancy and postpartum during breastfeeding to reduce vertical transmission. Infants usually receive several weeks of prophylaxis with zidovudine. Remember that all pregnant women should take antiretroviral therapy regardless of viral load and CD4 count. The most common side effect of zidovudine is myelosuppression, and that's why Isolde is dining on this dish that evokes an image of bone marrow. I have to admit, those erythroblasts look quite delectable. This can lead to anemia and neutropenia, which will be embodied in her white, anemic-looking dress. And to emphasize neutropenia and granulocytopenia, she's holding our recurring sand timer of falling granules as she awaits her lover's return. Lipodystrophy is another side effect, which involves the redistribution of fat from the extremities to the trunk. Patients may describe their legs looking like sticks while their central adiposity increases. This side effect is clearly seen in the majestic steed behind her, whose gracefully thin legs look like they're about to collapse under its more centralized adiposity. This is the trusty steed of Sir Steve, who represents stavudine. He's dining next to Isolde, so remember the "dine" suffix. Lipodystrophy is another common side effect of stavudine. This NRTI's major toxicity, though, is peripheral neuropathy, so remember those stockings and gloves we highlighted with lamivudine in the center. Our next knight is Sir Dan, who will represent adenosine. Though he doesn't have quite the same "dine" suffix, the word "dine" is hidden in there somewhere, so we've made him at the feast as well. Sir Dan is the newest member of the group, so it's his job to think of a cooler knight name than Sir Dan. Sir Danadine? And to do the cleaning. Adenosine's major toxicity is dose-dependent pancreatitis, and notice his sponge looks like a pancreas squeezing out some digestive secretions. The risk of peripheral neuropathy is also increased when adenosine is given with stavudine. So again, keep in mind those luxurious medieval stockings and gloves worn by Lancelot. No Knights of the Round Table sketch would be complete without Merlin, of course, and we're going to associate him with abacavir. Because, abracadabra! Need I say more? Abacavir can cause a hypersensitivity reaction that is strongly associated with the HLA-B5701 allele. So he's opened his spellbook to a spell titled HLA-B and he's turned to verse 57, line 01. This spell results in the presentation of self-peptides to the immune system and a delayed type 4 hypersensitivity characterized by a delayed rash, which is represented by his spotted rash appearing on the arm of our absent-minded sorcerer. He looks a little distracted as usual, so he'll most likely have a delayed reaction. And last but not least, the NRTI M-tricidabine, represented here as Arthur's trusty and exciting blade Excalibur. One unique minor side effect is hyperpigmentation of palms and soles, represented by King Arthur's bad-ass leather sword-handling gloves. Alright, let's sum up these NRTI Knights of the Round Table, shall we? Nucleoside and nucleotide reverse transcriptase inhibitors comprise the backbone of antiretroviral therapy. And like King Arthur's antagonizing mace, they work by competitive inhibition of HIV reverse transcriptase, represented by our reversotranscriptum spellbook. This halts DNA synthesis like the chain-terminated DNA bookmark. Arthur holds up the P scroll to remind you that these nucleoside analogs need to be phosphorylated to get activated. At the table are lamivudine Lancelot, zidovudine Isolde, stavudine Steve, and adenosine Dan, who all kind of incorporate that dine suffix, hence their dining. Important side effects to recall on the exam are Lancelot's stocking and glove neuropathy, the lipodystrophy of that noble steed, and lactic acidosis represented by the sour curdled milk at the center of our feast. Zidovudine is used as antiretroviral therapy during pregnancy and postpartum to reduce vertical transmission. Remember those high-yield side effects of zidovudine for the exam, bone marrow suppression, and resulting anemia and neutropenia. We also covered the NRTIs emtricitabine and abacavir, the latter of which causes the abracadabra delayed reaction. Yeah, you know what though? Let's not go to Camelot. 'Tis a silly place.